I want to talk to you about what we do know about core stability, because it's a very hot topic in the industry at the moment. It has been for a couple of years. I want to talk about conditions that you might see, specifically sacroiliac joint rehabilitation tonight, which is an interesting area, and especially which health professionals have a real shot at. And I want to share with you tonight what we're doing in our Better Back program. I think there's some things in the Better Back program that we use in our clinics that you can all take away and use tonight. And a lot of the exercises that I'll talk about are things that come from the fitness industry. So there's a lot of information there. The more you guys put into this, the more you'll get out of it, so please feel free to put your hand up. If I get short for time though, I may have to cut you off and get you to write your question down. I'm happy to hang around at the end of the presentation for as long as it takes. So ready to go to work and see what we can know about lumbar spines. All right, let's see what I've got here. Basically, that's our overview for tonight. My goal is for you to walk away tonight feeling good about what you're doing at the moment with a sight on what you're going to do next. Sometimes you go to presentations and you walk away thinking, gee, I don't do that, or I didn't do this, I don't think I'm doing the right thing. So you can walk away sometimes feeling a bit depressed about the presentation. If you feel like that tonight, I've let you down. And I tell you, that won't happen. You will take away things tonight that'll be aha moments for you that you can use in your practice and in your personal training sessions or rehab sessions as of tomorrow. That's basically what I'm about. I learned years ago, they say you'll learn probably 2 things an hour. That's not much, but they say when you go to a presentation, you remember a couple of key points. I'm going to aim for more than that tonight, but hopefully you'll get at least 2 an hour, so at the end of the day you'll have 4 points, but you'll certainly have more than. I'll ask you during tonight's presentation, what have you learnt so far? Try and remember as many things as you can. I'll sort of point out this is one of those moments that you may want to remember this bit of information, because there's some real key issues that come out of tonight's presentation. Let's get stuck into it. You would have heard about and know all about lumbar spines and lordosis, kyphosis and scoliosis. You would have heard about those terms. You've got in your notes there that pretty clear definition of, or the descriptions of lumbar scoliosis, etc. Sorry, lumbar lordosis. The only thing I want you to be aware of when you use the term lordosis, it actually refers to the direction of a curve. So for our purposes tonight, we talk about lumbar lordosis is a curve that way. So on a side view of me, we have a lumbar lordosis. We also have a cervical lordosis. Now at no time does that word mean it's increased or decreased. Sometimes you hear people talk about a lordotic spine, you think it's one of these really big curves. But we all have, if I've got a neutral curve, that is a lordotic spine. Because the nature of the curve that way is a lordosis. It's just called a lordosis because that's the way it curves. A kyphosis is the other way. So I've got a sacral kyphosis and I've got a thoracic kyphosis. That doesn't mean it's bigger or smaller, it just means that's the direction of the curve. So just be aware when you read those sort of things about the terms, lordosis and kyphosis, they don't necessarily mean the increase or decrease in size, it's just the direction of the curve. If I say you've got an increased lordosis, you'd have that. An increased thoracic kyphosis, you'd have that. Okay, so make sure the increase or decrease makes sense. You'll also hear about scoliosis. Okay, so we're talking about a lateral deviation of the spine.